Hi everyone, thanks for coming on to our second The Vitaccess Voice webcast. Today we'll be talking about capturing the patient's voice in real-world evidence studies. So now when we're talking about the patient voice, we're referring to the opinions and the experiences of patients and how these views inform medical treatment or therapies that they will receive. So when we're talking about patient voice, it is a difficult thing to define. But today we have three wonderful experts from all different domains to talk about how the patient voice, like what it means to them, and how we implement the patient voice in studies. So I'd like to go ahead. I'll introduce myself first. So I'm Anna Richards. I'm localization lead for Vitaccess. And my element of working with patient voice is with cognitive debriefing, interviews in various languages, and analysis of patient feedback in their understanding of the concepts within certain patient questionnaires. And I'd like to move over to Coralie, if you'd like to introduce yourself.
Yes, sure. Hello, everyone. So my name is Coralie Racinu. I'm the Marketing and Communications Manager at Vitaccess. So I look after all the marketing and communications around our real-world evidence studies, whether we do that online or in print to have at patients' events. We just want to make sure we reach as many patients as possible. And we also try and translate their voice and their language into a wider audience.
Fantastic. Thanks, Coralie. Marina, can we have an introduction from you, please?
Yes, my name is Marina Brocca. I'm Italian and I live in France. I work as a freelance translator and also as a service provider for an European federation dealing with a rare disease. So I can say that both in my personal and working experience, I have the opportunity to meet many patients attended by rare disease.
Fantastic. Thanks, Marina. And Catherine, can we have an introduction from you?
Sure. So hi, everyone. My name's Catherine Bottomley. I'm Director of Patient-Centred Outcomes here at Vitaccess. I'm responsible for how we capture the data in our research studies to demonstrate the impact of a treatment or an intervention or the burden of disease on, or the burden of living with disease from a patient's perspective or the perspective of those around the patient, such as the carer.
Amazing. I'd like to ask as well, what would you say the phrase patient voice means to you? If I can ask Coralie.
Yeah, well, I think that we have been living with the patient's voice on a daily basis here at Vitaccess. I mean, we do strive to get people, you know, to have them heard in an environment which sometimes, you know, they feel they're not actually being listened to. So to me, the patient's voice is really finding out what people are experiencing on a daily basis, which is what our, you know, study apps provide. And because they're doing that in the real world setting, they can do it as symptoms happen. And I think for us to carry their voices out there is very key to what we do.
Fantastic. Marina, what would you say that patient voice means to you?
Well, I'm not a technician. I'm not a data analyst. What can I give is the point of view of a patient, the point of view of the common people or person of the street. So what can I say is that one of the biggest complaints of the patients is the missing knowledge of the disease, because very few doctors, very few specialists and ordinary people know it. So normally patients, they feel unheard and they feel misunderstood when they report their symptoms and problems to the doctors. So in my opinion, the patient voice is a tool. We must say that first of all, that a single person voice normally is not enough. We need more people to join together to make their voices stronger. Patients want to be recognized as people who suffer and have problems, even if their symptoms are mild. So the patient's voice is the tool through which patients can make their condition known to doctors, specialists, and ordinary people. Is the way for them to express their suffering, their problems, and their needs.
Completely agree there. It's like, it's a tool really for them to be able to participate in research and participate
Yes.
in the decisions that are made, and sort of, well, essentially co-creating
Yes.
studies to fit them.
I want to add that in this case, the PAGs, the patient advocacy groups, are really important because they collect, normally the national association collect the needs of their associates. Normally they have chats, they have Facebook groups, so they really collect a lot of data that are exchanged in a very free way without how can I say, they don't stand in front of specialists, in front of doctors. They are among peers. They are free. They are really free to talk about their problems. So the role of the patient advocacy groups is really important. They can collect the voice of their associates. And in my experience with the association, I saw that at the beginning, a lot of time ago, patient associations were not taken in consideration in trials. Now they are, and this is very important because when you have to decide how can I say, endpoint? No, when you have to decide which are the most important things to take in consideration in a trial. Normally, scientists, they have some ideas that not really that are not really the right ones. Only patients are able to say which are the real problem of a patient. So which are the aspects that we have to take in consideration in a trial. So
Definitely.
Absolutely.
Yeah, really agree there.
Absolutely, yeah.
And Catherine, do you also like see this as the patient voice for you?
Yeah, absolutely. I think what Marina said really resonates with me. So research has shown that the impact of a treatment or an intervention on a patient and what a clinician thinks that impact is can often be very different. And so I guess for me, in my role, patient voice is all about making sure that that patient perspective, that true perspective, if you like, is heard alongside all of that clinical data in our research studies. And obviously, clinical data in research studies is extremely important. It tells us whether a drug or an intervention is working in terms of the disease improvement. So it might be through things like looking at biomarkers, looking at scans, looking at physical examinations. But for me, patient voice is all about what is actually happening to that patient behind closed doors. So what's the impact of that treatment or intervention on the patient's daily life in terms of how they feel and how they function? And that's the basis for patient-centered outcome measurement science, which is the area that I work in. So it's thinking about things like, can patients still take part in their favorite hobbies, for example? Can they make plans with friends? Can they socialize in the same way that they used to? What's the impact of a particular treatment or an intervention on their sleep, for example? And it's a real challenge in my role to make sure that we capture all of those all of that data and all of those issues that are important to patients in a way that's robust, and we produce data that's going to be accepted by stakeholders but is still reflective of those issues that are important to patients.
Fantastic. Thanks, guys. I wanted to ask then, what would you say that the phrase patient voice means to you from either a professional or a personal level? I'll direct that first at Catherine.
Yeah, sure. So I guess it relates to the introduction that I gave about my role, really. So my role is all about demonstrating the impact of an intervention from a patient's perspective. And I guess that's what patient voice means to me. It's about ensuring that that patient perspective is heard alongside the clinical data that is routinely captured in clinical studies. Clinical data is obviously extremely important. It can tell us a lot, particularly about whether a drug or an intervention is working or is beneficial in terms of things like disease improvement. So we might look at biomarkers, for example. We might look at the results of scans, or clinicians might physically examine patients to understand whether, from their perspective, a treatment's working. But what I'm interested in my role, and the field of patient-centered outcomes is interested in, is what's the impact of that treatment or intervention on the patient's daily life in terms of the way that they feel, the way that they function. So, for example, can they take part in their favourite hobby? If it's something that they perhaps couldn't do before taking that particular treatment, can they now take part in that hobby in the way that they did previously, or the way that they want to? Can they still enjoy it? Can they make plans with their friends? Can they still socialise? Can they maintain those relationships? And what's the impact of that particular treatment or intervention on their sleep pattern, for example? So the challenge that I have in my role is making sure that we capture all of those details and all of that data about the issues that are important to patients in a robust way, to make sure that it reflects the things that are important to them, the patient voice, but also that that data is collected in a way and presented in a way that's acceptable to various stakeholders.
Yeah, it is really lovely to see it from, it's really looking into the daily life, the true perspective really of like how patients are living with these conditions and what it means to them, what the treatments mean to them as well.
Yeah, absolutely. And I think these are things that when clinicians have conversations one-on-one with patients in a clinic room, these are the things that they often don't have time to cover. You know, they might ask, how are you feeling, or how are you getting on at home? But often that's where the conversation is limited, and we don't get to understand what happens when that patient goes back into their home environment. What's the impact on them? And importantly, what's the impact on those around them? So those who are living with them, those who are providing care.
It's, yeah, exactly. And it's also like a daily thing as well. You don't see your clinician essentially every day, whereas the way you're feeling and your quality of life is an everyday issue.
Yeah, and we have had patients actually kind of telling us that's exactly what happens. Like you know, when you go to see your GPs, they'll be like, "Oh, how have you been doing?" And you'll be like, "Yeah, I'll be all right." Bearing in mind you're pretty pressed for time anyway, and you won't remember that, oh, actually 3 weeks ago I had a really bad episode of cramps, or you know, or I just had like a really, you know, moderate fall that kind of, you know, was a pain for 2 days. But because you're in that instant talking to your GP, maybe a little bit stressed, you won't remember to kind of mention it. Whereas with the app, you just go in and you're like, oh, you know, I'm going to just put that in. And then, you know, when you go to see your GP, you can go back and say, oh, by the way, this happened. And, you know, even if on the day you actually, you know, weren't actually thinking about talking about that episode particularly. So I think that's what it gives, is just kind of like the voice is there all the time rather than just on, you know, on instant occasions. And then some of the gaps in between what's been going on just aren't recorded. So
Definitely,
yeah.
definitely. Marina, I just want to check you can hear me.
You know,
okay.
yes. I'm not a technician, so I will give you a point of view that is not the point of view of a technician, but the point of view of someone who is a patient in first instance and who works with patients. So it's a tool who allows you to track your symptoms is very useful. So the app is very useful. one of the biggest complaints and most significant problems for the patients is the missing knowledge of the disease. Very few among doctors and also among ordinary people know the condition, know the disease. So patients feel unheard and feel misunderstood when they report their symptoms and problems to the doctors. Except in the most severe cases, the condition is underestimated, if not considered, sometimes a problem in your mind. Yep. So what's the patient's voice, in my opinion? First of all, we must say that a single person voice often is not enough. More people with the same problem must join together to make their voices stronger. So patients want waiting for a drug or a therapy because for the disease I'm dealing with at the moment, there is no cure. Patients want to be recognized as people who suffer and have problems, even when the symptoms are mild. So in my opinion, the patient's voice is a tool through which patients can make their condition known to doctors, to specialists, to ordinary people. It's the way of expressing their suffering, their problems, their needs. So it is a tool that they can use to make themselves heard and known. That's it.
Yeah, no, it's really important to have like this like global view as well, because we're not just thinking about this from certain levels, like technical level or professional level, like as a clinician. Yeah. It's really important to have the patient's perspective, like they are what this is all for as well. So I'd like to ask this one to Coralie. What would you say the best approaches are to conveying the patient voice in any study?
Well, I think it's kind of like Marina was saying, is just asking them their opinion. And I think, when we start those studies, they are co-created with the patients and the patients groups. And we do ask them what would be useful for you, which questionnaires do you find useful, you think should be in the study, what is your opinion? And then it's not like we deliver a set in stone app. We just kind of go, okay, we've listened to what you've had to say, and between what research needs to find out and what patients need, feel they need to put out there, because like you say, Marina, some diseases, most people don't actually take them into considerations just because they're just like, well, we don't really know what's going on in this field, and we're just, we because we don't have the knowledge, we're just kind of going, well, if you're not suffering too much, then that's fine. And that's probably where the patients feel quite frustrated, because they're like, actually, every single day there's something minor, but minor plus minor it just becomes a big burden, and that's what we're trying to find out. And I think, and then, what goes into that is that once we've kind of started using, launching the study and patients have started using it, then we go back to them like 6 months on or a year on, and we're like, okay, let's have a feedback session. Just tell us what you think. And then, I know we'll talk about this a bit more later, but it is an ongoing conversation. It's not just kind of like, we've consulted you and here is your package. It's like, okay, and now tell us more, and let's keep listening to what you have to say, so that, we keep, because, there will be hopefully some improvement in care, which will impact that. Hopefully the burden will be less at some point. And it's like, how has that worked or not for you, and all these sort of things. So it is a conversation, and I think that's how it needs to stay. We just need to keep talking and being in touch.
Definitely, yeah. And I suppose in this one, I'm just going to take it back to real world evidence studies in general, just as we've been mentioning the app, but this is all part of a real world evidence studies. Catherine, could you elaborate a little bit on what real world evidence is?
Yeah, sure. So real world evidence is essentially the evidence that you obtain from collecting real world data. And real world data is data that's collected outside of a clinical trial setting. So real world data aims to capture the impact of a treatment or an intervention which is being given as part of routine clinical practice on a variety of outcomes. So it's looking at what is happening in the real world without those constraints of a clinical study. And I guess when we're talking about our app, it's probably important to mention as well that we are talking about Vitaccess's My Real World app, which is our data collection platform that we use for our real world studies. And it allows patients to input data on how they think or how they feel in their own homes. So again, it's really reflective of that real world element. So a patient can sit on their sofa, they can go on the bus, probably not so much at the moment, but behind the scenes, they're not in that controlled clinical environment, and they're giving us real-time information about how they think and how they feel about either living with a disease or the impact of a particular treatment.
Thanks for explaining that so eloquently. Marina, I was wondering if I could ask you about localization and the patient voice. So in localization, we have an element of cognitive debriefing where it's tested, the language is tested with patients for their understanding, and that's one element of patient feedback. But for you, is there any other way for you that you feel that the patient voice is heard in the way that you translate?
You asked me, but in the question you sent me, you asked me, in effect, if having a condition can impact the way of translating. Yeah. Yes, and I think that having a condition, whether it is not necessarily that of the study, certainly influences the way of translating. Of course, we must remain as faithful as possible to the source text, but we try also to choose the most suitable words for people with very high sensitivity. So we translate as we would like people to speak to us. Yes, of course. If you know the disease, if you are lucky enough to know the study disease, you have the advantage. You have an advantage, in effect, in translating the technical terms. And sorry, as far as possible, we try to use those words that are most understandable to the recipients of the study. Having a condition, whatever it is, can help you feel more close to the recipients of the questionnaire, of the study, of the app, and so on.
Yes, I suppose you're in a unique position as well. If you are a patient and a translator, then you can really channel the patient's voice in the work that you do.
It's not necessary in the sense that if you work with an app dealing with a disease, not necessary to have a disease, of course, but it can help. But because you know what is the sensitivity of the people you are talking to, so maybe it can help in choosing the right words, in choosing the right tone, in choosing the right phrases, not to be too aggressive, not to be too you don't want to give them impression to know much about them, but to let them express themselves. I don't know if I have been clear enough.
Absolutely. Very
Yeah,
clear.
definitely. I think that really resonates with me as well, Marina. You're talking about using the terminology that patients use on a day-to-day basis when you're translating. And I think that that really comes into designing a study as well. And in the work that I do up front when we're thinking about how we're going to actually capture this data. And that's where involving patients, I guess not just involving patients, but conducting the research with them and designing the research with them can be really beneficial. So I'm just thinking of a recent example. So we held a patient workshop a couple of weeks ago for a study that we're doing in migraine. And that in itself, as well as the kind of rich content that we got from it, I actually learned about some of the terminology that I was using surrounding migraine, and that actually that wasn't the terminology that patients wanted us to use. They didn't want their migraine to be described in the way that I was using it. You know, I was talking about them experiencing migraines, and they said it's not always like that for everyone. These migraines that you talk about are not always distinct attacks. Actually, what happens is some people experience distinct migraine episodes or distinct migraine attacks, and that's how you should be describing it, in the same way that you would describe asthma and an asthma attack, for example. And so even little insights like that at the start of a project can really help us when we're designing patient-facing material, and making sure that we're using that terminology that is not only understood by patients, but is also acceptable to them. And I guess in that way, patients are not going to look at the questions that we present to them in the studies and say, the people that design this clearly don't understand our disease. You know, they don't understand how we want these attacks to be referred to. I guess that can be really off-putting for people as well if they start a research study and the terminology is not being used correctly.
Completely, yeah. I know that Coralie, you're familiar with patient workshops as well. What kind of how do these work, and what kind of feedback do you ask or input do you ask at these workshops?
Yeah, so we've organized a few of those after some of our apps were launched, and well, basically, so obviously people register and give consent to be contacted about the study for further questioning. So we just send them an email and an invitation and say, oh, so we've done them either on the phone or we've done them back in the days when we could face to face. So I think the next ones will be virtual face to face, like what we're doing now. And then we just kind of go through, what their experience is. And we kind of ask we just start with a very global question, which is like, okay, what do you like in the app and what do you not like so much? And then we take it from there, and then we move on to like, well, what should we keep and what should we not keep? Or what should we change? And we basically go through every feature in the app and questionnaire. Obviously, there are things, as Catherine very well knows, and so do you, Anna and Marina, that questionnaires, some of them, are locked by the authors, and we've got no margin of any change on them. But anything we can change, we do try and do. So again, because we're having a conversation, if patients say, oh, this is really a painful thing, can we change it? Then we can say, well, let us go back to the authors, see if we can do something, or if we can't, and then we can explain as well. Sometimes it will be technical problems that prevent us from changing or improving something, but on the back of those workshops we've made really big changes, like and I think Marina Brocca can testify on our Charcot-Marie-Tooth study, for example. People were kind of like, oh, the one thing that's really painful was that we need to re-enter this every time. So that's how the medical profile came about, just because patients were like, this is really burdensome to have to redo this all the time. So now we've created a section in the app where people can just update all the information about their diagnosis, treatments, surgeries, lifestyle, instead of having to complete a full survey for it. So, and it's been, since then people are like, yeah, no, that's a lot easier, because they just need to go console. It's like, no, this hasn't changed. Oh, this has changed. Let me change it. And it's, it's just user friendly and saving them time. And then, hope it's more enjoyable for them than it was before. With our melanoma study, we launched a community feature because people were like, well, where people can just find each other depending on their diagnosis, their location. They can, offer to give support and advice, or they can want to ask for supported advice. And like one of the patients says, like, it's really useful because sometimes you just want to speak to someone who understands, and if you're not going through the same stuff, then people just can't understand, and we all know that. It's unless you've gone through it, you it's not the same. So yeah, all of that stuff is, and it's brilliant even for us because I've been very lucky doing the marketing and doing some filming with patients as well, to meet our patients, and they're just inspiring people, and very uplifting testimonies, and it's just been amazing to just meet them and work with them on these projects. It really has.
Fantastic, because I know you've met with patient ambassadors as well, patient advocacy groups, which all feed into that. They're all helping to uplift the patient voice and make sure that they're heard in these studies.
Yeah, and all I can say is, if you go to our YouTube channel, you've got some of our patients' videos, and they're worth watching.
Great. Yeah, we'll definitely check those out.
Yeah.
As well as making it a better experience for patients using our app, we've got to think about the wider benefits to our studies as well that we see from taking this approach and getting this constant feedback from patients along the way. So it's things like better engagement with studies, the questions are going to be better understood, therefore patients are going to be more likely to complete more questionnaires.
Absolutely.
And our data set's going to be more complete, and therefore our data is going to be potentially higher quality. So there are benefits sort of later down the line to taking this approach earlier, which I guess could be seen as a process which extends period of study design. It could be seen by some as not being necessary, but the benefits that we see at a later stage really demonstrate what a great approach it is. Absolutely. To both the patients and to ourselves as researchers.
Yeah. Would you say then that patient workshops are one of the many ways we check that data collected by Vitaccess reflects the issues that matter most to patients, or are there other ways of doing it? Like, how do we ensure that data is correctly reflecting the issues?
Yeah, that's a good question. Do you want me to start with my opinion from the work that I do? So most of the studies that we do focus on understanding the burden of a disease from a patient or a carer's perspective, and we do that by building these adaptive registries. But within that, we obviously have data from patients who are taking different treatments, who are switching treatments throughout the research period, so we can address particular research questions around the impact of certain treatments as well. And we capture that data through the use, as we've talked about, of questionnaires. So these are patient-reported outcome instruments. And we also supplement those with additional questions that we design ourselves to capture issues that are not included in some of these standardized validated questionnaires. And through this combination of instruments that we design or put forward for each study, we're aiming to paint a complete picture of what it's like for that person to live with a disease. So the first thing that we need to do is understand in detail exactly what it's like for a patient on a day-to-day basis to live with the disease. And we normally do that through qualitative research. So as well as conducting these patient workshops that focus on the actual study design itself, we also go out and talk to patients in depth through interviews or focus groups about what it's like on a day-to-day basis to live with a particular condition. And it may be that some of that work has been done already and already published. So in disease areas that we've worked in, which are where the research is much more or the research has already been conducted, there's a lot of research around the area, there's a lot more interest in that area, we can use some of that data that's already been published ourselves. So we'd always start with a literature review. If there's not data that's out there, or it's data that we want to ratify or explore in a different way, that's when we go out and actually talk to a group of patients. So I guess what comes out of that, from my perspective, is a list of themes with some examples or sub-themes. And these are common themes within that qualitative data that explore all of the concepts or all of the different ways that a patient can be affected by living with a particular condition. And then it's up to us to identify suitable questionnaires that we can use to capture that rich data. So you can imagine the data that comes out of interviews or focus groups. It's really detailed, it's really in depth. People are giving us really in-depth examples of what it's like to live with that particular condition. And it's our job and our challenge to then reflect all of that in questions that can be hosted on an app. So it's a question where somebody can complete that, as I gave the example before, sat on their sofa, and they might be asked to rate something from 1 to 10, for example. And so it's a real challenge to get from all of that rich qualitative data into questions that reflect that. And that's one of the things that we spend a lot of time doing in our study design process. And there's a huge amount of work that goes into that. So we ask for patient feedback in terms of how questions are phrased in particular questionnaires. We ask for patient feedback about recall periods, so how long patients are being asked to think back over when they're completing these questionnaires. We ask them about the response options in the questionnaires, so are they able to accurately reflect what they think and they feel from the different response options that are provided to them. And then most importantly, we ask them about completeness. So if we're putting together a list of, say, 5 or 6 questionnaires that are going to be used in a study, does that reflect all of the broad areas of their lives that are impacted by suffering from a particular disease? And if not, what can we do about it? So I guess from my perspective, that's how we make sure that all of those complex issues are reflected in the studies that we design. And it's a combination of us doing the desk research ourselves, looking at what's been published already, what's already out there we can learn from, and then really spending time learning from patients what it's like to live with that disease on a day-to-day basis and how we can reflect that in the questions that we develop.
Completely agree there. I was going to ask Marina if you'd like to say, in your opinion, in what other ways like patients can contribute to make themselves heard in studies?
It's difficult to say because I have a long experience in associations. Workshops are a very good tool, a very good way to ask people to collect data from patients. But sometimes talking about themselves or talking about our problem, it's not easy. So if you can do it in if you allow people doing so, remaining anonymous, that can help people to open up. So a questionnaire, or maybe it can be an excellent way, an app, but app is the result, in effect. It can be an excellent method, yes, of course.
So more like working towards it being more relaxed in an environment where they just feel they can really talk about the issues. It's not too rigored and like a clinician setting, I'd say. It's not too formal.
Yes. Yeah. Yes. For example, with association I cooperate with, we launched some questionnaires, but they were anonymous. So people were invited to answer to some questions. But in questionnaire, the problem that in the questionnaire, the answers are closed answered, or you have multi-choice answer. And it's something that is already decided. So I can understand the problem that Catherine spoke about, because sometimes you give them the opportunity to express freely, but they say a lot of things and it's impossible, or it's very difficult to collect all this data for a statistical purpose. So it's a very huge work. So I don't know. I can't give you really an answer. There are a lot of ways to help people, to help patients express, to say which are their problems, daily problems, which are their main issues, which are their needs, and so on. But I don't know, I'm not a technician. You can give them a lot of way to express themselves, but the problems is always how to collect all the data, how to put all the data in a simple way, to be able to do a questionnaire that can take in consider all the different issues. It's not easy. Yes.
No, it's definitely
And
it's not an easy job.
I'm really admirative for those who prepare the questionnaires, starting from the patient's answers, because in the most of the cases you have a lot of data, and to collect all those data is not, I can imagine, is not easy. It's not an easy job.
Yeah, absolutely. Welcome to my world, Marina. I guess one of the benefits that we have to designing real world studies and using our app is that we can supplement some of these standardized questionnaires with our own bespoke questions as well. So, for example, if a group of patients has told us that there's a particular concept or a particular area of their lives that's really important for them, but is not something which is typically captured in these standardized patient-reported outcome measures, we can develop some of our own bespoke questions to sit alongside those to explore that issue in a bit more detail. So we have a little bit more flexibility, and often then we can uncover things that are new or things that are exciting, things that perhaps haven't been reported previously in other studies, particularly in clinical trials. We have a little bit more flexibility in the way that we design our studies. But yes, as you said, it's still a huge challenge.
Yes, but for example, when data are reported in clinical trials, I think that patients are a little bit, are not totally sincere. I mean, they are facing doctors, they are facing specialists. They don't feel free to express themselves. While if they do it in an anonymous way, they feel, oh, okay, now I can say what I want to say. Now I can say what's in my mind, what I'm feeling. But we come at the same problems. The collection of the data is not easy. Maybe we can give patients the opportunity to express themselves, but with a limited number of words. I don't know, maybe choose one single word to express your main problem, or something like that.
Yeah, absolutely. I think it depends on the type of interaction we're having with the patients as well, don't we? So sometimes yes. I'm thinking about the workshops that Coralie and I are involved in, and we only have a very limited amount of time to hear what a lot of people have to say. So it's about how we facilitate that, isn't it? But I guess in other situations, you know, I was talking about the concept elicitation, qualitative data that we collect to understand a condition. And in that situation, we want people to talk in depth. Obviously, we want them to stay on topic, but we want them to talk in depth and to give us, you know, as many examples as they can think of, and as richer data as we can. So, yeah, it certainly depends on the type of interaction that we're having with them.
Yeah, could you elaborate a bit more on concept elicitation? So how you work out the concepts from the feedback that's given to from a patient?
Yeah, sure, absolutely. So we tend to conduct a wide variety of interviews or a wide variety of focus groups. So we have a lot of data, usually very lengthy data from a number of people, and we, with patient consent, would record these interviews, audio record these interviews or these focus groups, and we would have that audio recording transcribed so that we have all of that data in a written format for us to analyse. And then there are various approaches that you can use to analysing qualitative data. The approach that we would most commonly use is thematic analysis, and that's where we're looking for commonly occurring themes or concepts within that data set. So, for example, patients may give very different examples of the hobbies that they can or that they can't do as a result of suffering from a particular disease. So one patient might say, this impacts me doing my gardening. I love gardening. That's what I can or I can't do. My disease has this impact on it. And somebody else might say, well, I really enjoy, for example, playing golf. We can then categorize those. They're examples of a theme, which can be called hobbies, for example. So people will give us a lot of individual examples, but we're looking for commonly occurring themes in that data. And you can do that in a couple of ways. You can do that manually. So I've done that in previous settings. You can imagine reams and reams of transcriptive interviews, going through that manually, colour coding with highlighters, identifying those common themes and how they all fit together, looking at the relationships between them can take a long time. Luckily, we now have software that can do that for us. And when we're doing that at Vitaccess, we take a team-based approach to it. So we have multiple coders. So we're talking about how we're coding that data. If we're seeing what we would call a common theme in that data, we're ratifying that with somebody else who's also coding that data as well. So it's an iterative process that uses a team-based approach.
Fantastic. It sounds like a lot of hard work, though, I must say.
It can be. I mean, you have huge amounts of data, and I think people often underestimate how long it takes to analyse qualitative data. But you can imagine that the benefit that you get from conducting that research and understanding how the patient talks about their condition in their own words is hugely beneficial.
Well, I'm going to probably wrap up now. I just want to say that I think we've definitely covered how patient voice is from our perspectives and how it fits in with the global view of how we're eliciting the issues into the studies. I was just wondering if, Catherine, you might elaborate on how is the patient voice heard in Vitaccess research studies specifically?
Yeah, sure. So I guess we've talked about this a little bit along the way, and we've given some of our own examples. But I think it goes back to what Coralie talked about earlier, which is establishing a really solid relationship with patient representatives or patient organisations right from the start of a study. So when we're designing a protocol, when we're thinking about what study is going to look like, developing and maintaining those relationships throughout the study. And that's one of the things that I think we're really, really good at. And has real benefits to our studies. I think the other thing that we do at Vitaccess to make sure that our patient voice is heard is that we work cross-functionally within our teams. So I work very closely with Coralie from a marketing perspective, but we also have a user experience team who are brilliant at understanding what it's like for a user with a particular condition to interact with our app. We have our localization team, of course, we have our data team, and so everybody brings a different perspective as to what they mean by patient voice, and we work really well cross-functionally. So I think that's really important in the studies that we do.
Definitely. Oh, thank you. Well, thank you all for participating today. It's been a really interesting chat, and I hope we've covered everything. If anyone wants to say anything now to add to what they want to say, I don't know, Coralie, you'd like to?
No, I was just going to say, or forever hold your peace.
Or forever hold your peace, exactly.
No, thank you for having us. It's always great to be talking about the patients and giving them a voice, because at the end of the day, I think that's why we all get up in the morning for. So, yeah. Absolutely.
Thank you very much then, guys, and I'll see you for your next webcast in the
Thank you.
Thank you very much.
Thank you very much.
Bye.
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 Bye.